Hello, my name is Frida Martin, and in this presentation I'll be discussing research findings on the response effects caused by utilization of a proxy respondent in health surveys. When filling out health surveys or questionnaires, it is not uncommon for older adults to get help from a proxy respondent. A proxy respondent is anyone who either acts to answer questions for the person in question, known as the self-respondent, or helps the self-respondent to answer the questions. A proxy respondent could be anyone, but a study done by Dr. Wolinsky determined whether the person responding affected the responses, and this study focused on children, children-in-law, and spouses as proxy respondents. The findings of this research revealed that there are specific differences between self-respondent answers and proxy respondent answers. When filling out health information, both proxy respondents and patients themselves tended to match Medicare claims records on treatments that were invasive or needed a lot of monitoring, such as diabetes, cataract surgery, or glaucoma. Sons and daughters-in-law also tended to match with Medicare data across the board. Self-respondents tended to underreport their own health burdens and underreported how much health care they receive as well, although patients who demonstrated high thinking ability on a cognitive test also demonstrated responses that were more similar to Medicare claims. Husbands and wives did the same, underreporting their spouse's health needs, while other proxy respondents tended to report more health conditions than were actually reflected on Medicare claims data, but overall tended to be more accurate than spouses. Currently, surveys often ask whether the survey was filled out by the patient or a proxy, but do not ask the relation of the proxy to the patient, and do not ask whether the proxy was the sole respondent or just helped the patient respond. The results of the Wolinsky's research demonstrate that it is necessary to note these last 2 points, and thus a change is needed. To address these 2 missing data, health surveys should implement a few additional questions which ask whether a proxy respondent was used, the relationship of the proxy to the patient, and the role that the proxy respondent played in filling out the survey. Once these questions have been implemented, the team assessing the survey results will be able to compensate for differences in respondent answers when aggregating data. For example, if 100% of the responses had no proxy involvement, the survey facilitation team would be able to infer that the survey responses probably trend lower on reports of disease burden and healthcare recipients than is realistic. Another step to utilizing this data is to inform the administrators of health teams that are conducting surveys. This will better prepare them for using the data on proxy respondents as they gather it, and it will also help to persuade them into gathering such data because they will be shown the findings from Wolinsky's study. Wolinsky's research focused on data gathered by the Assets and Health Dynamics Among the Oldest Old survey, or the AHEAD survey. This survey is in conjunction with the Health and Retirement Study, or HRS. Because this data was used in the research done by Wolinsky, from a statistical standpoint, the study findings are most likely to apply to this survey. Therefore, the HRS team will be the target to which the research findings will be implemented into their normal work processes. In particular, the administrators and survey facilitators of the HRS project will be targeted with education and pitch the idea of including the questions mentioned on the previous slide into their surveying. As a result, the participants who take part in the survey are also part of the population being targeted by this research implementation. 2 indicators will be used to measure the success of implementing the findings. The first will simply be whether the proposed questions, or a modified or improved version of those questions, were added to surveys done by HRS. This will determine whether the research was successfully implemented. The second will be how substantial of an effect the questions had on data analysis, i.e., how strongly they affected estimates of national health outcomes. This will determine whether implementation of the research was useful and how useful it was. And of course, my reference was Wolinsky's research. Thank you for watching.